Interesting TCM and Acupuncture. Part 23, Interesting Pulse Diagnosis. Key points on pulse diagnosis, Part 1. Thesis. Chinese medicine study of diagnosis of illness uses pulse taking as one of its specialized diagnostic methods. This is one of the four methods of diagnosis of observation, auscultation, inquiry, and palpitation. It is also a means by which the illness pattern can be discovered and is essential to Chinese medicine. Pulse diagnosis uses digital palpitation of different places on the human body to find the pulse. This is the technical basis of finding pulse presentation and is also called pulse palpitation, pulse diagnosis, pulse pressing, and grasping the pulse. Pulse has a profound relationship with the five organs, viscera, qi, and blood. If the organ qi and blood become ill, the blood's movement will be affected. The pulse presentation will thus be changed. Pulse presentation in clinical practice can help us extrapolate the nature of an illness and its prognosis. Clinical practice requires mastery of pulse diagnosis time, the body positions of the ill patient, the finger method of the doctor, and its relative pressing strength. Every time that a pulse is taken, it must be observed for a count of 50 beats. At the same time, we must understand the pathological change from a healthy pulse in order to make a pulse diagnosis. 2. Historical evolution. The study of pulse diagnosis is of the utmost importance to Chinese medicine history. It has undergone many generations of systemic study and clinical experience from ancient times. The Annals of History record, in the Annals of History record, also called the Shiji, the ancient physician Bian performed the four diagnostic techniques of observation, auscultation, inquiry, and palpitation, and this has spread to every area of China. Sima Qian's Annals of History say, in today's world, when we speak of pulse taking, it's because of Bian. This is in reference to the ancient Chinese pulse diagnosis creator Bian. Actually, this is not a precise statement. It's believed in historical research that during the spring and autumn period and the warring states, pulse diagnosis was already well developed. At that time, texts such as the Yellow Emperor Internal Classic and the Classic of Difficulties were already discussing complete methods of pulse diagnosis. In 1973, a significant number of ancient Chinese scrolls, many over 2,000 years old, were discovered in the third funerary area of the Ma Wang Dui tomb complex. Of specific interest were the pulse method and yin-yang pulse diagnosis manuscripts, as well as other unique methods of pulse diagnosis of the period. At that time in history, pulse diagnosis in Chinese ancient medicine was already an important aspect of clinical practice. By the Han Dynasty, Chinese pulse diagnosis was already universal. In the Annals of History, there's another discussion of Dr. Chun Yu-yi, which explains how teachers taught pulse methods for 3 years. From this record, we can see that when treating illness, there was a requirement for pulse diagnosis. During the Eastern Han, another famous doctor, Zhang Zhongjing, wrote in his book, Discussion of the Assorted Illnesses of Cold Damage, put forward pulse diagnosis methods which show the universality of the technique at that time and how they related to clinical diagnosis, proving that this time was a major developmental period for TCM pulse diagnosis. By the Jin Dynasty, the famed doctor Wang Shuhe collected the work of previous doctors and clinical experience and wrote the Pulse Classic. This is the earliest full recording of a medical text entirely dedicated to the study of pulses. This book provides information about 24 discrete pulse types and describes the significance of each presentation. It also explains the use of pulses in pattern differentiation and represents the maturity of clinical understandings of pulse taking. After this, Chinese medical pulse taking texts increased in number, and pulse diagnosis in Chinese medicine has become a major scientific area of investigation. In the Qing Dynasty, there were already 100 plus texts on pulse taking. Pulse diagnosis is a method of understanding the condition of the meridians and collaterals and is a major area of meridian and collateral study coming from the I Ching tradition of medicine. This was recorded in the Hanzhi as originally people's blood and pulse meridian and collateral bone and marrow, yin and yang, exterior and interior, are the root of illness and what separates life and death. Today, pulse diagnosis is done at the third gate of the three gates of Tunkou. This is the Taiyuan point of the lung meridian, but sometimes is also called the Fuyang, Taishi, Renying, three separate acupoints on the body. Because they can show certain pathologies at specific meridians, pulse-taking methods, although developing separately, can be seen to have great importance far back into history. In order to differentiate the meridians and collaterals is the major work of pulse taking. After the period of only taking the Tunkou pulse, the main purpose was to discover the diagnostic principle and pathogenesis. This can help differentiate patterns and treatment together. Thus, it's sufficient to use pulse taking as a means of differentiation. Pulse diagnosis was developed in ancient China, but is a very good method of medical treatment which can be used by the entire world. Until today, pulse taking is one important practice of Chinese medicine. 3. Pulse taking basic requirements. Time. Pulse diagnosis differs relative to time, and it's best performed in early morning. The simple questions subtle essence of pulses chapter says, pulse methods are best done in early morning. Yin qi has not yet moved. Yang qi has not yet scattered. Food and drink have not yet entered. Meridians and vessels have not yet flourished. The meridians and collaterals are adjusted, the qi and blood are not dysfunctional, then it's possible to perform diagnosis on the pulse. Because early morning is a time before most patients have eaten or drunk, when they move, there are many specific effects on the body. The inner body and external environments are peaceful and quiet. The qi and blood and meridians and vessels have not yet become disturbed. Then it's easy to differentiate pathological situations clearly. At the same time, this is not to say that at other times it's not permissible to take a patient's pulse. Wang Ji believed, if the patient is ill, any time can be used to perform pulse diagnosis. It does not have to be in early morning. In summary, pulse diagnosis requires a peaceful and quiet setting. Before taking a pulse, first ask the patient to relax and breathe comfortably. This will allow their qi and blood to be level and peaceful. The diagnosis room must be peaceful and quiet, and must push out all sounds from the outside world which might startle the patient. This will assist the practitioner in finding the proper pulse presentation. In special situations, you can follow time and location as required to perform pulse diagnosis. It's not absolutely required to follow the above rules, just optimal. Location. Make the patient sit or lie down in an upright position. The forearms and hands must be placed at heart level with the wrist straight. The palms of the hand must be facing upward and the back of the wrist must be sunk on the table, exposing the inner wrist so the pulse may be taken. Incorrect body position will affect the movement of qi and blood, thus changing pulse characteristics. Finger method. Doctors and patients must sit facing each other. The left hand of the practitioner must press on the right hand of the patient. Use the right hand to press the left hand. Taking the pulse with the finger requires you to use the middle finger to locate the guan point, the high point of the wrist bone. Then press the Cun position with the first finger. Finally, press the Chi pulse with the third finger. The three fingers all press in a bow shape and are level. The fingers must press in order to allow the pulse to be conspicuous. Use the fingers in such a way that you can get an accurate sensation. The closeness of fingers is also important. If the patient is tall and has large arms, you should space the fingers out slightly. If the patient is short and has smaller arms, you should bring the fingers closer together. The three fingers should be kept level and use strength to push down all at once. This is called collecting pressing. In order to understand one specific pulse presentation, you can also use a single finger on one position. If you're taking the Cun pulse location, you can slightly lift up the third finger and the middle finger. If you're taking the guan position, you can slightly lift up the first and third fingers. If you're taking the Chi position, you can check and lift up the first and second finger. Single pulse palpitation is frequently used in clinic. For pediatric inspection, one finger is used on the guan position, and it's not possible to differentiate all three positions since the child's arm is small. Also, it's more difficult to take pulse since children often cry and do not cooperate. Holding, pressing, and investigating. This is the level of power used during pulse taking. If one-hand method of pulse taking, Hua Boren said in his Hinge Secret of Diagnosis text, there are three ways of holding the pulse: holding, pressing, and investigating. Lightly using the hand is called holding. Pressing deeply is called pressing, and not light and not heavy is called investigating. When first taking the pulse and holding the fingers superficially over the skin, this is the yang representation and represents the viscera. It also holds the image of the heart and lung. Heavy pressing goes into the flesh and is yin, representing the organs. This is the liver and kidney image. Not deep and not heavy is in the space between the flesh and blood. It is yin and yang and represents mixture. It is the presentation of spleen and stomach. If floating and deep are not found, then you must focus on that point. If hidden is found, it is yin-yang hidden lying pulse. Each of the three positions follow this logic. Lightly using the finger on the skin surface is called holding. It's also called floating or light taking. Heavy pressure is called pressing and goes between the tendon and bone. It's called deep and heavy. Using neither heavy or light, which can be changed between heavy and light, is called investigating. These three methods of holding, pressing, and investigating are the key methods of taking pulse to look for pathological change. Also, the three positions can each be palpated separately. So you must find the proper position and press around the place investigating. Investigating is a means of measurement. It doesn't mean pressing down in the center. Level breathing. One out breath and one in breath are called one complete breath. When we take pulses, practitioners should breathe evenly using one exhalation and one inhalation while counting the number of pulses. If the pulse is relatively slow, count using the breaths. Also, the practitioner must make the heart quiet and tranquil. Focus your attention and place the entire focus of the mind on the pulse. The Simple Questions Pulse Subtlety discussion says, the way of holding the pulse is in protecting peace and stillness. 50 count is sufficient. Every time the pulse beats, make a count and wait for 50 counts for each position. This way you'll be aware if there is any change in the pulse. This requires you to also perform 50 counts on the second and third position as to differentiate clearly the pulse. Thus, each time you take a pulse, it will take between 3 to 5 minutes. Aside from that, one other thing is that the practitioner should not accidentally use light pressure for 3 beats and strong pressure for 2 or other random things. In summary, pulse diagnosis has been collected as one of the central methods of Chinese medicine treatment. It originated in the study of meridians and collaterals. It's included in the I Ching tradition and was cited by Han Zhi. As originally people have blood and vessels, meridians and collaterals, bones and marrows, yin and yang, external and internal, and is the root of the 100 illnesses and the difference between life and death. Until today, pulse diagnosis has been done with the 3 gates of Tunkou. On the Taiyuan lung meridian, pulse sometimes can be performed on the Fuyang, Taishi, and Renying, which represent different meridians. Even though pulse taking originated on its own, it's been added over time to and has a broad impact. The purpose is to differentiate etiology, pathology, and is used to differentiate patterns in order to satisfy the goals of diagnosis and treatment. Thanks for watching.